So here we're in the laser room, we're in the designing suite. We're going to design an AthensProtocol case. First step is to look at the epithelial maps. And we can see there's very little epithelial change, a little bit blue here. So this could have been a scrape, but we like the epithelial scrape with the laser because it will allow for better penetration of the riboflavin peripherally, as we've shown that it overtreats in the periphery. So we'll use here 8mm diameter, 40 microns in thickness to remove the epithelium. And now this is the refractive data on this patient. So refraction is minus 225, minus 325 at 173 degrees. Uncorrected, not bad, almost 2025. Best corrected, better than 2020. And the age here is 32. So we'll go to the topo guided software. We'll add the data. And okay, we have good thickness, yeah. That's fine. It's a very central cone. The thickness is very good, so it allows us to go with the large optical zone. So now we're treating on the optical zone that is available in the US as well. So in the US you can go down to 6mm optical zone, no further. We can go in Europe down to 6. And these are the pentagon maps of the same 32-year-old patients. You can see this is a relatively mild cone, mainly astigmatism. So we'll zero the refraction to see what the topo guided fix will be initially. This is what the topo guided fix will be. We like it. So of the topographic cylinder of minus 384, we're going to treat. But again, the very tricky part here is, fine, the spherical equivalent on this patient is about a -1, but we have keratometry here of 51. So we know that once we reshape this cornea, this will induce myopia for the patient. What's the actual length of it? So we can preempt that with an actual length of 23.581, this patient without the cone and with a keratometry of about 43 would have been maybe 1 diopter hypero. So if we have keratometry of 51, when we normalize this patient, this will definitely induce myopia. So our treatment will be, let's look at the pentagon maps again. And these are the sitemap ray tracing data. And we can see that the cone is creating this completely horizontal coma. Confirmation from the pentagon HR of the astigmatism with the sitemap device. So we'll go back to our treatment designing. And so now we will treat here the full astigmatism, so minus 125. Not at the axis of the refraction. This is the toughest step. So the refraction is at 95 degrees, but the topographic cylinder is at 171. So we're going to go cylinder 171, treat minus 125, and add an arbitrary 1 diopter myopia, because we know this eye will turn out to be steeper once you normalize the cornea. So I know a lot of this sounds completely arbitrary, but it is the result of years of experience. And we'll treat this on the epithelium, then do an 8mm 40 micron epithelial removal afterwards to complete the 2 treatments, followed by CXL 6 milliwatts per centimeter squared for 50 minutes. So that's our design for AthensProtocol on this patient.